The term scoliosis means a curvature of the spine. So if you look somebody from the front, you're supposed to be straight, but scoliosis means you're S-shaped. The spine is curved one way or the other way, so you're not exactly straight. And most of the time, you don't need anything for that. Just some physical therapy is good enough. But then there's a subset of patients that eventually need surgery. It all depends on the age of the patient, the category of the scoliosis, to come up with a treatment plan as far as the surgery goes. So kids are treated differently than adults are. Unfortunately, as much as we've advanced in the field of spine surgery, and we can do a lot of outpatient surgeries, this is definitely one surgery that's not outpatient at all. I mean, it has to be done in the hospital. Typically, the bigger the operation is, the more likely the patient will require an ICU stay. The patients typically can stay anywhere from 4 to 7 days in the hospital, and some of them, depending how old they are and how debilitated they are, they may have to go to rehab afterwards. Now, there are many reasons why people get scoliosis. You can be born with it. You can acquire it later on in life, like meaning you can go 50 years, 60 years, you're fine, and all of a sudden you start developing scoliosis. The most common reason is what we call adolescent idiopathic. It means adolescent kids get it. Idiopathic comes from the word idiot, and we don't know really. That's one of the main scoliosis categories. But there's a lot of reasons people can get scoliosis. If you're in a car accident early on, you damage some disc, maybe you will get it, or you're genetic. Genetic is also obviously a very important factor. We don't really know all the reasons, but it happens. But the good news is that most patients don't need surgery. Most patients definitely don't need surgery. There was a study that was done by in Iowa. Basically, they followed patients for 50 years. This is a very well-known study, and they showed that that a lot of people who have scoliosis, they don't have to do surgery, and they're fine for like anybody else who doesn't have scoliosis. And basically, the treatments are to try to be in good shape, do some physical therapy, chiropractic, acupuncture, conservative therapies seem to do the trick on most patients. But at some point, it progresses to a point that you're going to have surgery.